Hello, and welcome to your Chapter 1 Pathology lecture. So, pathology is the scientific study of the causes and effects of diseases. And according to your textbooks, diseases are the loss of or changes to normal structure and function. And that applies to any part of the body, right? You can have a change in the structure of your skin by way of a rash, and loss of function through less range of motion, say in your spinal column. So here's a cool thing. 75% of people receiving massage today are doing it for a specific issue that they've already talked to their physician about. That means more often than not, the massage therapy profession is now in a place where healthcare practitioners in the West are now sending patients to massage therapists very often for palliative care, which means pain relieving. For instance, we can relax the muscles and help a chiropractor because muscles pull your bones. Your spinal column can get a little janky and get subluxations and torsion in it, which we will learn about in Chapter 5, because your muscles are tight and pulling it out of proper position. Massage therapists work great with physical therapists because we help to relax the muscles and increase range of motion to get that function back into the body. We even work well with specialists like gastroenterologists. Anecdotally, I had a patient that would come see me 3 times a week for an abdominal massage for constipation. And 3/4 of the way through the massage, every time they would get up to go to the bathroom, and we would just do like a little light finisher on the abdomen, and they would be back 2 days later. And that was how they maintained healthy bowel movements. If someone is inflamed because of lack of lymphatic drainage, there is a specialty massage for that you can get certified in. There are all types of massage modalities and techniques for all types of diseases. And this is an absolutely fascinating course, and I encourage you to get interested and see if there's something that you hear about or read about that you absolutely want to study further, and I would love to help you with that. Throughout this course, you're going to find that I like to give you guys lots of videos to watch, files to look at that may have photographs, keywords, various terminology, just things that I find interesting that might help you study the subject a little bit better outside of your textbook. And for Chapter 1, I've included your pathology textbooks, Appendix A and B abbreviations, which are super important to learn, and also your Module 1 keywords. I have put those in your Week 1 file folder. And if you look in your MBLEX practice tests and resources folder in the file section, there are also anatomy terms that will help you. They are all of the suffix and prefixes for anatomical terms that help you learn the location of a muscle, the insertion of a muscle, the direction of a muscle, or the function of a muscle or a bone, that will help you guesstimate your way through something if you don't remember the exact answer, say on your anatomy MBLEX exam. But I cannot express strongly enough how important your anatomy and physiology terminology is, not only to pathology, but just to the body itself. So please print these, save these, study them, highlight them, read them, sing them. And absolutely an active learning technique is to teach them someone else. Even if you're talking to a stuffed animal or a window in the room, just repeating it out loud in your own words to teach someone else imprints another way in your memory processing center to learn this terminology. The more basic terminology you can get down, the more you can figure things out just by hearing the terms, even if you've never heard what this disease or you cannot remember what this muscle is. Terminology is absolutely your cheat code for this. So here are some general terms you definitely need to know, and some more terms that you definitely need to know. And here's some about bacteria, toxic agents. No, we're not talking about ex-friends or family members. These are chemicals, plant resins, and other things that can cause rashes, diseases, etc. Please, please pay attention to these key terms. Download the file, study them. So these are interesting transmission general keywords. This is how you got it. Was it through direct contact? Were you touching someone? Did something drop on you as they coughed? Did you touch someone's dirty doorknob? Did you eat food that had gone bad? Did you drink bad water? Get Montezuma's revenge from drinking an amoeba when you went on vacation in Cabo? What happened? How did you get it? Now, across the bottom, I have included something interesting. This is the game I like to play of which rash is it? As you can see, there are some very distinctly different looking manifestations of infections and diseases. And we will cover these in more detail in week 3 as we cover the skin and various issues of the skin. But something fortuitous that happened as I was recording this course, if you will look at this third picture right here, cellulitis. Here's a funny anecdotal story for you. So on August 10th, my mom is texting me and she sends me this photograph of her swollen red foot. And I'm like, so you have cellulitis? Because I know a thing or two about pathology. And my mom, who's been a registered nurse and has seen hundreds of cases of cellulitis, was, no, I think I just hurt my foot. And I told her, no, absolutely not. Like, you need to go to the ER. Cellulitis can be very dangerous, especially if you are someone who's prone to heart issues like my mother is. And so the next day, she does go into the ER, as you can see by this photograph, and she has a swollen foot. My mother's foot is normally half of this size. It's pretty terrifying. She got put on immediate antibiotics. And now this third photo is on the 14th of August. You can still see the line and the swollen toes, but it certainly looks better after antibiotic treatment, although her cat seems to be quite disgusted by her foot. So, these diseases happen in your daily life, and paying attention in pathology can really help your family members identify when they need to get to a medical facility ASAP. These are all slides out of your PowerPoint, just so you know. So there's no extra file other than the keywords that I really want you to go and download. But pay attention to this slide when you go through the PowerPoint discussing what an infection actually is, the immune response to the infection, the fever, and inflammation. Absolutely pay attention. And I have included your textbook's awesome illustration denoting the different stages of inflammation, which are swelling. You're going to feel heat because of the vasodilation and all of the extra hot blood going to the area, and the swelling is caused by all of the fluid that's rushing there. You get a loss of function because of all of the swelling. It's going to restrict and limit motion. Obviously, there's going to be redness with the swelling and the additional red blood cells in the area. And you're going to have pain. Things are stretching. They're being pushed down on. They're being restricted, plus the pain of the actual infection. There's a lot going on in the inflammatory response. And one thing to know is that if someone is infected or they are undergoing an acute stage of inflammation, These are local contraindications unless they have a full body infection. They're on antibiotics, something like that. This is a total contraindication. Absolutely don't massage that person. Postpone it until it's been completely resolved. And absolutely look at your PowerPoint, look at your textbook, go back over things like Price and Rice. Get familiar with steps that you can take within your scope of practice if you're doing this to a client in the massage therapy office, and even for things like self-care, to make sure that if you get injured, you stack your joints incorrectly massaging someone and your wrist feels a little inflamed, make sure that you know how to take care of yourself after something like a deep tissue gone wrong. So I've thrown out the words contraindication, local contraindication, and absolute contraindication. And we can use the old stoplight image. Green means go. It means massage is indicated. We can do it. Pus yellow, that yellow light is a local contraindication. Just like an exploding boil. We don't want to go anywhere around it. But it doesn't necessarily mean we can't massage the rest of the body. Our bright fever red is a stoplight. It is a medical alarm blaring. Do not touch this body. This could be literally a fever. It is a fever red light. It could mean that this person has a systemic infection. It could mean that this person is highly contagious. Do not massage this person at this time. Just to reiterate, a local contraindication would be something that you can just avoid locally: an inflamed area, a medicated patch, a pacemaker, a lump, a suspicious mole, a rash that is only in a very small area. These are okay to go around. Check with your client first, make sure there's nothing else going on, and you can go ahead and finish the massage on the rest of the body. Absolute contraindications are fever red stoplight. We are not going to massage this person at all. Of course, is a fever, a widespread infection or inflammation, or they're highly contagious, or if they have a chronic disease, but it's in its exacerbation stage. Now, as you go over your keywords, you will see that there is remission and exacerbation. When something is exacerbated, it is present, it is inflamed, it is there in its peak form. That hive or rash is bubbling. That patient feels terrible. When it's in remission, your client feels fine, or sort of fine, but the rash is not present, the itching is not present, the pain is subdued, versus when it's in its exacerbated state, which you do not want to mess with or touch them to make the situation worse. Also, obviously, if your client is in a state of medical emergency, they need CPR, they're having a heart attack, you're not going to continue the massage. Absolutely do not massage them if you are unsure of their medical condition. And when in doubt, if it's a problem client that keeps coming back and you're just not quite sure, feel free to request a doctor's note. Have them get a prescription for massage, have stipulations put in there when it is safe, what is not safe to do during the massage, what is recommended, and you can move forward from there. One thing that is covered in your Chapter 1 full PowerPoint in your book, and even in a couple of videos I have included for you, are standard precautions, such as hand washing. I've also included a hand washing video. These are vital for you. Utilizing hand sanitizer, cleaning your equipment, cleaning your tools, washing your linens properly with appropriate cleansing solutions, wearing gloves when appropriate if someone is infectious or you are unsure of something, or in something like a buccal massage if someone has a TMJD issue. I did want to include this picture out of your book though, because it drives me nuts. Yes, picture A is great. You start by peeling off your glove. You tuck it inside of the hand with the other glove on in picture B. And then in picture C, he is just letting it free dangle in the air. Don't do that. Hold it completely in the fingers of the glove, please. And then as you peel it off your hand, scoop it around so that one glove is inside the other, and then you can dispose of it nicely. And you still wash your hands afterwards. And I would even follow up with hand sanitizer after every client because you never know. Please study your standard precautions and utilize them in your daily life. This photo is not some amazing cheese and spinach appetizer. This is what appears to be a shea butter mixture that was dipped into and then left with air getting to it, and a nice bacterial or mold bloom has started in it. Always use a pump top if you can. Your book says use a flip top. That's why that's here. I wouldn't. You're still getting skin cells underneath the flip top. You're still squeezing it out. Some excess lotion can get caught in the cap and build bacteria in there. Pumps are the way to go. You can buy a little pump belt. There are massage stools with attached little baggies that hang underneath it for your lotion to go right there next to you on the stool to pump if you do seated massage. And sanitize your bottle after each use. Sanitize all around where you open it. Sanitize the top of your pump. If you're using a jar like this for shea butter, because it will not work in a pump, absolutely sanitize that jar lid. Use a spatula or a tongue depressor every time and put it in one of those disposable little 2-ounce plastic cups. If you're concerned about the environment, yay for you. Awesome. Use a glass small dish that you can wash properly and sanitize after each use. Make sure that you are keeping these lotions clean, all of these butters clean, because not only are you smearing mold and bacteria on potentially open places on your client's skin, they're going underneath your nail beds, they're going in your cuticles, they're going into any open wounds and open pores that you have in your hands and forearms, and you are breathing in the mold spores that are developing on top of this stuff. Keep your equipment clean, not only for their safety, but definitely for yours. Your PowerPoint should have the live links that are on this slide, but I just want to say, don't be late, stay up to date, and yes, public safety is paramount, and you are part of the public, so your safety is important as well. Don't ever listen to someone with single anecdotal evidence. Please make sure that you go to a trusted national, or even better, international, global site for disease control and prevention. You can definitely check out the CDC, but there's the National Institutes of Health. There's the U.S. Department of Health and Human Services, but I definitely recommend the WHO, the World Health Organization. You can also check in with like the AMTA or other massage organizations, but they're not going to be nearly as quick updating their websites and whatnot with issues that have to do with public contagions. Go back to your PowerPoint, click on these live links, save them, bookmark them, or keep them in the back of your mind for the rest of your career so that you know where to go to get the most accurate, up-to-date information to protect yourself and to protect your clients and your practice. All right, I'll see you for chapter